The Pediatric Association of the Gambia held its second annual scientific conference and annual general meeting on Friday at the Sadoda Kairaba Jora Conference Center. PATG is a professional body committed to advancing practices and improving child health in the Gambia. Its mission is to provide safe, reliable, and efficient health care for children through education, research, advocacy, and evidence-based practices. This year's conference was themed Optimizing Maternal and Newborn Care in the Gambia, with the sub-theme promoting safe motherhood and reducing childhood mortality. Delivering his remarks, Dr. Mustafa Abite, Chief Medical Director at the Edward Francis Small Teaching Hospital, emphasized EFSTH's commitment to collaborating with PATG to provide the necessary training and resources.
Our hospital, the Edward Francis Small Teaching Hospital, is responsible for the training of pediatric doctors, and we are happy to be integral in this association that you have. The hospital will work with the association to provide the necessary training, and together we can provide the optimal training. We hope that we can work together in developing protocols. We see that in other associations, developing guidelines and for treatment. The hospital hopes to explore your potential to develop our research culture in the hospital. Currently in our hospital, I think we are managing only 5 grants. With the level of staff we have here, with the capacity of the people that are in the hospital, that is too low. And we think that we'll work together, you support us, so that we can, by next year, maybe we'll be managing 10 grants and continue to improve as we go.
The association's core mission is to enhance child healthcare delivery through evidence-based pediatric care, research, policy formulation, advocacy, innovation, and the training of its members. Additionally, PATG aims to establish a safe and efficient healthcare system for children, both in the Gambia and across the sub-region.
2 years ago, there was a very horrible event that took place here in the Gambia, where over 85 of our children died of the acute kidney injury due to contamination of a syrup of diethylene glycol. And one of the interventions that took place that time was because we had a nephrologist who noticed this quickly, and that effort really reduced the mortality that we had on our hands. So as the frontier of pediatrics expands, you discover that the capacity that we have to protect the population will continue to improve. Yes, I admonish the Pediatric Association of the Gambia to ensure that they provide a program that expands pediatric care beyond just the West Coast region or the Greater Banjul area to other parts of the country.
Highlighting progress in child health, Professor Chipuze Haya Njogu, Senior Head of the Internal Medicine Department, acknowledged the Gambia's achievements in maternal and child health while stressing the need for continuous efforts.
That so far, accreditations have been procured or got: ONG, surgery, pediatrics, internal medicine, family medicine, maxillofacial surgery. Even is in top gear that laboratory medicine will soon be accredited. That's a stride. It should be sustained. It should not be left unattended. So I commend the people and their funders, and I pray that those who are making it possible for this to be funded should not rest on their oars until Gambia is buoyant enough to generate its fund.
A representative from UNICEF presented key statistics on child mortality in the Gambia, underlining the importance of collaborative action to address these challenges.
Our shared objectives is to ensure that every child in the Gambia not only survives but thrives. Aligning our efforts with the National Development Plan and, of course, the Sustainable Development Goals to uphold the right of every child, be the child born in Banjul or in deep rural areas of Sierra North. every child has the same right to survive and thrive. The Gambia has made notable progress in maternal and child health. From 2013 to 2020, maternal mortality rate declined from 433 to 289 per 100,000 live births. The child mortality rates for children aged 1 to 5 years fell from 20 to 15 per 1,000 live births. Time to celebrate. However, why this is important for us to get together to understand where we can do even better. We are still far from the SDG targets of 70 per 100,000 live births, maternal mortality, and also 12 per 1,000 live births for child mortality. We are on track, but we are quite far from the SDG targets.
The chairman of the Pediatric Association of the Gambia, Dr. Adama Salah, noted significant achievements in technical and scientific knowledge, which have contributed to improve pediatric care in the country.
As we recognize and celebrate the spectacular advances in pediatrics in recent times, including but not limited to the development of simple but appropriate treatment methods and technology. For example, oral rehydration, kangaroo mother care, KMC, and drugs for the treatment of bacterial, viral, parasitic, blood, and malignant diseases of children. However, there has also been setbacks. For example, persistent nosocomial infections and increasing antimicrobial resistance. The mechanisms of many genetic, nutritional, and metabolic disturbances have considerably been clarified, and means of identification of risk factors and early detection of diseases greatly enhanced. The important relationship of the well-being of the mother to that of the child is increasingly becoming recognized, and this is of particular importance in our settings.
This marks the second annual scientific conference organized by the Pediatric Association of the Gambia, dedicated to promoting the well-being of Gambian children. The conference aims to address childhood diseases through collaborative efforts, encouraging active participation and support in implementing effective measures to protect children's health. Reporting for Kerfatu, I am Buba Gajigo.